Good morning, everyone. I thank Vibhuti sir for giving me an opportunity in this IC. So since we are running a bit short of time, I'll go fast. My topic is disc dissection by OCT, which is very important. In OCT helps early diagnosis of glaucoma. Early diagnosis is very important because that's we can halt only the progression of the disease. It's a progressive disease, and perimetry has poor sensitivity and repeatability, and you need at least 3 tests to reliably confirm glaucoma. And most importantly, axonal cell loss, the structural changes occur much before the functional changes. And when we see the spectrum of disease, we can see the ganglion cell layer changes occur much before the nerve fiber layer changes, and that occurs much before the visual field level changes. So OCT, if we can detect at the nerve fiber layer changes, or even before that at the ganglion cell layer changes, we can detect the glaucoma at a much earlier stage and start the treatment. Glaucoma primarily affects the 3 parts of the eye. The cupping, we can see the nerve fiber layer thinning and the ganglion cell layer. And OCT uses these 3 to analyze, and we take the circle of analysis around the optic nerve head, and this is scanned, and 6 linear scans in spoke pattern are taken 30 degrees apart and centered on the optic nerve head. And this is the printout how it looks like. The first part, and I'll go in detail, is the thickness map. Now thickness, the retinal nerve fiber layer is thicker in the upper superior and inferior parts. Inferior more than superior, more than nasal ISNT rule. So superior and inferior, the warm colors, the red and the orange, code for the thicker nerve fiber layer. So it's an hourglass pattern because it is thicker in the superior and inferior. And the warm, cooler colors, the blue, code for the thinner nerve fiber layer. So the thinner is more in the nasal and temporal. So normally the hourglass pattern is should be maintained. The next is the deviation map. Now deviation is, now each OCT stores a normative data, age and age matched data of the similar kind of patients. Now comparing the patient's profile report with this normative data, we can color code it. So this is deviation map. Now their color coding is different. If it is falling in the green area, green is 95%, which is normal. If it is coming yellow, that means it's a borderline changes. This falls in the 5%, lower 5% of the population. And if it is coded red, red coding means it is falling in the lowest 1% of the population, and that indicates abnormality. So the deviation is deviation, how much it is deviating from the normal. And this deviation is used by this color coding map. And the thickest 5%, of course, in the white area. So the normal fundus image is overlaid with this thickness map of the patient, and the deviation is coded. And you can see the same is done in a testnet graph also, where the temporal, superior, nasal, inferior, and temporal. The bold line and the dotted line. The bold line is for the right eye and the dotted for the left eye, and whether it is falling in that green zone, it's the normal zone. If it is touching the yellow area, it's the borderline because the lowest 5% population. And if it is going in the red, again it is abnormal, because it is in the lowest part of the spectrum. And the double hump pattern should be maintained because the nerve fiber layer is thicker in the superior and inferior parts. So this thing is for the right eye, and left eye it is done. And the lower one, which you can see, it is the dotted and this here, you are seeing both the lines, and inter-eye symmetry is being followed or not. The same data can be also represented in a clock hour pattern and also in the sectoral pattern, means all the 4 sectors can be depicted. Here in this, sectors are being depicted, and here it is in the clock hour pattern. So this same value here, this is similar like the deviation, and the color coding is similar in this, green, yellow, and red. And using this, we can see whether, when we read out, we have to also see whether the image quality is good or not. It's 0 to 10, the image quality is greater than 8 is like it's a good quality image, and below 6 we should discard because that's not a good quality of image. Progression report can be done when you see the successive OCTs and see whether changes are occurring over a progressive time, progressive changes, and that can be depicted both in the thickness and the deviation map. You can compare. And this is the ganglion cell layer normally, and how it is thinned out in glaucoma, which is occurring even before the nerve fiber layer. I'm going fast because of paucity of time. Okay, so in ganglion cell also has deviation and significance map. Here color coding is different. So yellow and red areas have above average. Blue is around 20% loss and black is 50% loss or greater. And the same, these data can be used to analyze a 3D animation, and we can always relate the fiber changes, the disc changes, and the field changes. And always it is the sum total of all which should help us to diagnose glaucoma and not based on a single test. So here is a case where we see a cup disc ratio 0.7 and we are not seeing field changes. In the other eye, we are seeing a 0.8 and we can see inferior arcuate defect. When we do the OCT, we can see that even it is correlating, and some changes, it is more advanced than the visual field is being depicted. And in the OCT can also be used for the angle evaluation, where we can use it to see angle structures, and also we can actually measure the angles also subjectively by drawing the angles. And after PI, before PI and after PI, we can see the image, opening of angle. And topography can also be done using PACI is also done in this. So I would just like to conclude that it's not just a structural test, one OCT which should help you to diagnose glaucoma and you say it's a glaucoma. You should see it, compare it with your optic nerve image, your field changes, and your OCT. And if all is pointing towards glaucoma, then only diagnose a glaucoma. Thank you.